Dr. Apurva Popat again, and today we have a special guest with us. That's Dr. Akram, who is expert in advising about Australian Medical Council exam. So welcome, Dr. Ahmad. Please tell us about yourself.
Thank you so much, Dr. Popat. And my name is Dr. Akram Ahmad. I'm a medical scientist in Australia. So I always make videos for healthcare professionals. So if you are looking to migrate to Australia, so A to Z information, they always provide, is there any new information about the exam and immigration, visa and all those. Thank you.
Awesome. Thanks for coming into my channel and thank you for your time. So tell us more about Australian Medical Council exams.
Yeah, if you are from India or Pakistan, I mean, if you have a medical degree like 6 years and you are planning to migrate to Australia, so once you complete your degree and you are a registered medical practitioner in your country, so you can directly move to Australia. So there is a 2 exam you need to write. It's called AMC 1, Australian Medical Council, exam 1 and 2.
Okay.
So one mostly is like mostly MCQ based. So and till like about 65% is about passing rate. So most of them they just pass, AMC 1.
Okay.
And once you pass AMC 1, so there is an opportunity for you can migrate to Australia, but there is a little bit low chance. But if you complete AMC 1 and 2, there is a high chance, So once you complete AMC 1, so you can register as a limited, you have to work under another GP, or GP means a general physician or a specialist, you have no right because you just a limited registration. You have to clear. So you clear AMC 1 in your country online, then you can be registered as a limited registration, Then if you are write AMC 1 and 2, then this is called a provisional registration.
Okay. So if you just give AMC 1, you need to work under general practitioner in Australia. But if you give just both AMC and 2, you can work directly.
No. AMC 1, I'm giving you this is shortcut for you.
Okay.
So if you want to come in Australia, so you just complete AMC 1 in your country.
Okay.
And you can come to Australia,
Okay.
Then you can... in simple word, you can say you can work as a assistant,
Okay.
And meanwhile, you can complete your AMC 2.
Right.
Yeah. So this is like a shortcut. I'm not saying you must work under any
Okay.
GP. No need to work.
Okay.
If you complete AMC 1 and AMC 2, then no need to work any under any GP or something,
Okay. So basically, you need to clear both AMC 1 and 2 in order to get the provisional certificate.
Yes.
Okay.
And then we call the registration is 3 types. One is called limited. Then this is provisional after AMC 2. AMC 1 is the limited. AMC after 2, AMC 1 or 2 to give you the provisional. But after AMC 2, you have to go for internship. It is called residency in 1 year in Australia. Then you will get a general registration. Then you can work as a medical practitioner.
Right. So you complete AMC 1, AMC 2, get the provisional certificate. Then you do your 1 year of internship, and then you get the general practitioner certificate. So what if you want to join the residency in Australia?
Residency means you are talking about the master degree.
Like MD medicine or...
those pathways are a little bit different. So for example, if you have a master degree, MS or MD from your country, now you want to migrate to Australia. So your experience must be like more than like if you have 7 year, 8 year or 10 year, you have experience working as a specialist in India, then you can go to that pathway. But if you have like less than 5 year experience, then they will not count as a specialist. You are not a specialist. Then you have to again go for a residency for 4 to 5 years based on you are choosing a like pediatrics or surgery or general medicine, internal medicine, whatever you are choosing. But if you have 7 year experience, then directly you can register with any university. And in that university, you have to work, any specialist for 1 year or sometime 2 years is based on your curriculum or your experience, because this is like country to country vary. And then you will be you can work as a specialist in Australia.
Right. So like after getting the general practitioner license, what if you want to do post-graduation in Australia?
Yes.
MD.
So basically, this is the main route. Everyone just complete bachelor degree in India and they want to come for master degree in Australia.
Okay.
So this is we can divide into two parts. One is the clinical and non-clinical.
Okay.
So if you are coming in non-clinical, for example, anatomy, physiology, public health, or whatever, pharmacology, so that directly you can get an enter without registration. No need to be a registered medical practitioner.
Interesting.
But if you want to go for clinical, for example, you want to be a surgeon, you want to be a pediatrician or internal medicine, or in that case you must register. You have to complete AMC 1 to register as a practitioner, work 1 year. Then after that you have to work for once you complete your GP, now you are a general physician in Australia, you have to work 2 to 3 years more.
Okay.
Then after that you have to apply for university for specialization. Yeah,
I get you. So this is like something new and interesting, that if you want to just do non-clinicals, you don't need to do even AMC 1 and 2.
Yes. I mean, I always suggest, if you want to work in Australia as a doctor, it is exam is easy. AMC 1 you can pass, most of the doctors pass, but the main problem is the visa, and you have to find a job offer letter. So if you are you want to just skip this pathway, so you just come to Australia to take admission in any master degree. For example, Master of Public Health or MS in Pharmacology, Anatomy, Physiology. So this is just to get enter in Australia, and then you can clear AMC 1 and 2. Then you can find your. And another important yet, if you are coming to master degree in Australia for 2-year visa as a student, after you complete your this 2 year, you will get a additional 2 to 3 year another visa called a post-working visa, post-study working visa.
Okay.
So this visa is very important for you, because in that visa you can find a job, you can file your PR, you will get a permanent residency in that way. It's easy for you.
Okay, so I get you. So after I've done my AMC 1 exam, and as you said, after doing your AMC 1 exam, you can come back to Australia and like work under some GP in order to get some experience.
Actually, there is a condition, once you complete AMC 1 and you want to come to Australia, you must have one job offer letter.
Okay. All right.
Yes. But this is not very, very tough. It's not impossible. It's very tough, not impossible. So because, if you are ready to work in some of the regional area, means the small cities,
right?
Then they will give you contract, and like you have to work for them like at least 3 years or 2 years. They will contact you with sign. Then they will give you letter. Then you can file your visa. You can come to Australia. So there are several visas you can file basically. After AMC 1, very limited visa you can file, because you need to get someone sponsor you for your job. So there is one called 407 visa number. 407. This is they call a training visa. You are coming on a training. But once you come to Australia, and after that the sponsor can give you one additional year, or then you can file your PR, because at that time one more year you are getting, you can clear that AMC 2 exam.
Okay. So if I want to come to Australia after AMC 1 and 2, what's the visa process? So what exactly I need to do?
Again,
you again need to have a job offer letter even after AMC 2?
Yes, there is a need, and there is no need. So there are several visas doctors can file. I already made 3-4 videos on this topic. So one visa you can file, you just complete AMC 1 and 2 and you want to migrate to Australia. So Australia's central government have their own list, and each state have their own list. For example, in my state there is a scarcity of doctors, so I will calling them, you come to in my state, you have to work in my particular state. So there is a visa called 189. This is from a federal government. It's called number 1 visa basically, if you are just bachelor degree, But if you have low point in Australia, basically visa depend on your points. If you have low point, then you will get a regional visa. It's called a 491 visa, and this visa will give it to you 5-year visa. So you have to work for 3 years. After 3 years, you will file your visa. It's called a PR visa, permanent residency. You can file.
Okay.
Another visa is called 190. So this visa basically, if your point, for example, you have 70 points, then the state given to you 5 additional points. So it's like now your point is 75. Then you have to work in that particular state. For example, if if you are coming in New South Wales, so you have to work New South Wales at least for 3 years. And after that, you can move to any other state.
Okay. So you mentioned about points. So what determines the points?
Yes. Basically, points, a points system is a little bit, most of the doctors are, some doctors have a bachelor, so they have an advantage to come to Australia. So if you are a bachelor, so you must come Australia, I can say. So, the point based like on your education, your experience, and your English requirement. For example, if you have 7 IELTS, then you will get 10 points. If you have 8, then you will get 20 points, and your age is like you have younger than like 32 years, then you will get 30 points. But if you have more than 32 years, then it will be like 25. They will reduce the points.
Right.
And if you are single, they will give you 10 additional points. If you are married, then it will be 0. But if you are married and your wife has for example, she also has some profession. For example, she is also a doctor. She might be a nurse. She might be a physiotherapist. She might be a pharmacist. So her occupation is in the list. Husband and wife both are in the list. So wife also can give 10 additional points to the husband, or husband can give it to the wife. So
Right. So you talked about IELTS and all this English exams. So what makes you eligible for AMC exams?
Actually, if you are looking to register as a healthcare professional, so there is a body called APRA, AHPRA. So this is APRA is the main body. For example, in India we call like MCI, we can say. So यहाँ पर क्या है ना, whatever your profession, you are a nurse, medical doctor, physiotherapist, everyone has to register for this body. So the body you must have 7 band IELTS or equivalent, PTE or that OET, all this. If you have any English requirement, 7 IELTS, you can register. But English required 2 times. One is for registration as a medical doctor, you need 7 each. But if you have 8, as I told you in points, you will get 10 additional points for that. So just try to get as much you can get higher points in IELTS.
So IELTS is like compulsory if you want to move to AMC, like Australia.
Yes, I mean any English test. Yes.
Okay, so even OET is valid there?
Yes, OET, most of our healthcare professionals, they preferred OET. Some of them even TOEFL also. Some of them maybe the Cambridge, but very famous here called PTE. It is very, very easy for Australia to recognize PTE. So if you are getting 7 in IELTS, then 8 you can score in PTE. So PTE is very, very easier compared to the IELTS or the TOEFL.
Okay, so I get you. Like, thank you so much for this information. So, and you mentioned about like AMC 1, 2, and you also give some English exams, and meanwhile you file your visa. So if we just count the entire duration, how much time is required for all this process?
For example, if you complete AMC 1 from India, and you are now applying, so but in total time at least it will take 1 year to 2 years.
Okay.
Because when you are just to clear AMC exam, now you have to look the job offer letter, or maybe you have to clear that AMC 2. So AMC 2 is very, very tough. I can say it's not very easy. So it's about right now the passing rate is about 14 to 15% only.
Oh, really?
Yes. So AMC 1 can be 65%, but AMC 2 is like 15%, especially those are from India, So that's the big thing.
So AMC 1, can you tell us more about AMC 1 and 2? AMC 1 is like preclinical or MCQ. What about AMC 2?
Actually, AMC 1 mostly we can say is like, the basic medical science. Pharmacology, physiology, anatomy, microbiology, biochemistry, those kind of subjects they will ask more. Clinical part, but this is basically called a OSCE exam. They will give you a case, and you have to solve, to find out the problem.
In AMC 2?
Yes, this is really very tough. There will be 2-3 doctors, and you have to perform, the procedure.
Right. Okay, I get you. So after you have done your AMC 1 and 2, and after you have done everything, what's the doctor's salary in Australia?
Salary is very good in Australia. Even in normal GP, you just a normal general practitioner. So your salary, I can say, is 150 to 200k per year. So if you see in Australia, the top 10 highest salary. So 5 profession in that medical doctors only. So like neurologists and surgeons, they are highest. They are earning.
Right. So that's a handsome salary.
Even some doctors, those are young doctors. They are not yet married. They don't have kids, those kind of thing. So they are working here as a locum locum doctor. Locum doctor means that you are working 1 week here, 2 week there, so they charge very high. You can earn up to $3,000 to $4,000 per day. So say they just work like 10-15 days, and 15 days they just relax,
Oh, right. That's just like hospitalist in United States, I think. So in hospitalist in United States, it like works the same way. They work for 2 weeks and they have off for 2 weeks. So you can relate the salary in terms of INR, like how much it would be in INR?
INR, I can say 20,000. I mean, I can say 5 to 6 lakh minimum, I can say, minimum. Okay. You are not doing anything extraordinary. You just a general doctor, so you can earn 5 to 6 lakh.
Oh, so you're talking about per month?
Per month, yes.
Okay, yeah. So if I just compare this with United States, if you are just a resident there, your salary is around 3.5 lakhs per month if you are a resident. And after you're done your residency, if you are working as a general practitioner there, your salary is around 14-15 lakhs per month. So that's about United States. But great to know.
Actually, your salary, I'm saying it's like lowest. So it's like, if you see many doctors, they are earning here 200K. So 200K means, you can say like 7 to 8 lakh is very common.
Right. Perfect. And how about the cost of living in Australia?
Australia is very, very good, especially if you are Indian. So Indians are living here like about 7 lakh Indians are living right now here. So about 3% population Indians are living in Australia. And wherever you go, so there is some suburb will be there for Indians, So Indian groceries, Indian restaurants, all those things is very, very easy. We are talking about the cost of living. So if you have a small family, for example, you have a 1 or 2 kids, or you have a husband, wife, so they can be like 3 to 4,000 enough to live.
Okay, I see.
Per month.
Okay. All right. So that covers pretty much everything. So do we have any visas? Like, do we have to apply in embassy if you want to just like visit Australia, just like visitor visas kind of thing?
Yes. There is many doctors also ask me this question that, sir, can I complete my AMC one and can I come on the visitor visa in Australia and got a job?
Yeah.
So, legally I can say no, you cannot work.
Yeah, you cannot work on visitor's visa. That's correct.
But many people I know, they did the same. Because, when you are coming for this visa, so the visa condition is that you can live up to 3 months in Australia. Okay. Then you have to go back. So what did the people, they just try to find out a job. So, for example, in my area, there's 50 GP clinic. So I can go visit one by one and I can apply online, So I'm in Australia, I'm looking this and that. I already completed my AMC one. So this is, I can say, like a very good opportunity for you. You can explore in this way as well.
Yeah, got it.
And another very important, I forget to mention that, for example, if you are planning to come Australia and you are married, so very simple for you just for your wife can come on a student visa. Any study, for example, any MBA, MPH, MSW, any course. If she coming and you will be dependent on your wife or your husband, for example. So you will have a full work right.
Okay.
So your wife can study and you can work. So whatever you are spending for 1 year a tuition fee like $20,000 to $25,000, you can earn within 2 to 3 months, as a medical doctor in Australia.
Okay.
So
good.
So it is so good strategy for you. You can just clear AMC one and you can come on a student visa either for you or your wife or your husband. And it is life very, very easy for you in that way.
Okay. Right. Yeah. Get you. So what final advice do you have for students who are like aspiring for Australia?
This is based on, when we are talking about USMLE, and AMC. So USMLE, as I told you that you are in beginning year 2 or 3, you are planning, then you must try for USMLE because I can say in the world, the highest opportunity in the US. But if you miss that opportunity, so I can say, you must try Australia. Don't go for even it is better than UK or Canada, it's not just the money, the lifestyle and the weather, all those things, So I can say at the end, you must try for Australia. So best you just clear AMC one from India. You just come on a student visa or your wife, whatever is work for you. So you must try. And here is the life is very good for you.
Right.
I can say,
Awesome. Thank you so much, Dr. Akram Ahmad. And if you guys like, he has his own channel. He advises all the medical and the paramedical students to about how to migrate to Australia. So do check out his channel. I'll leave the link of his channel in the description below. And if you have additional questions about how to move to Australia to be a doctor there, please leave a comment there and we'll be happy to help you. Thank you for your time, Dr. Akram Ahmad.
Okay. Thank you. Bye-bye.
Bye-bye. Thank you so much.